So I gave them all careful instructions that they needed to sit in a blue chair. So good, nice job so far.
I complied.
Awkward seeing your picture here.
First test.
Yeah.
So how do we strike that right balance between leveraging AI and technology for medical care while ensuring patients receive compassionate and empathetic care? And what strategies can providers employ to maintain the strong human connection with our patients? Jace?
I get to start. Well, thanks for having me, and I'm looking forward to the discussion. I don't think that technology and compassion are mutually exclusive. I think technology can play a number of roles. One, it can take away administrative burden from clinicians so that they can spend more time directly with consumers, and doing so by removing some of the administrative tasks like documentation. We're working with Microsoft on how do we automate the documentation such that it can be more useful, more accurate, and less burdensome on the clinicians so that they can spend their time interacting with consumers. I think the other thing is that technology, and in this case AI, can help clinicians be more culturally sensitive, understand the consumer and their circumstances and what's going to resonate with the consumer, but I don't think it can replace the clinician. I think that's a massive fallacy, and if the technology ends up being a barrier or an obstacle between the clinician and the consumer, then you end up in a place where you have a gap in that compassion and that connection.
Yeah, I certainly agree, and I think we have to think about it in terms of kind of various components. So the comment around the administrative waste, we all know there's extreme inefficiency that exists in the system, and we also know that how much that contributes to the overall cost, and we keep talking about that aspect of things as well. Then there's the piece around, I think that's also being alluded to, is around how do you assist or augment the care and the relationship, and so to do that in ways that are constructive as well as acceptable to the patients as well, and I'll come back to that. And then the other piece is we think about this as well, it gets to how much autonomy do you permit the technology to actually have. And I think that's where we create the greatest amount of fear, and I think that from the comments that we've already heard throughout this day, that we're not quite prepared for as healthcare leaders and as those who are part of the system. But also that if you look at the various surveys that are being done among recipients of the care, that they're certainly not prepared for in the way we'd want them to. So let's come back to the augmentation piece. I go back to when I was seeing patients and in a room and had a computer. And I can recall at times being reminded and occasionally mindful of, more often reminded, that I had my back turned to the patient, that I was typing things in, that they were unaware of exactly what I was doing, and I was also deeply frustrated by the keystrokes that I was having to input. I'd like to say all those things have been resolved, but we actually know very well that they haven't been, but I think we've gotten better. And that's part of that personal relationship as well. We're gonna have to make sure that what we don't do is suggest that the technology is the priority. We've got to continue to say the relationship is a priority, and the things that we're introducing as tools, that we do it in a way that's in consideration of the primary reason, and that is to have a relationship between two human beings or a team of human beings who are caring for each other in these vulnerable states.
Hey, you remind me, Kelvin, when I was in a similar position, taking care of patients in that office when computers first came around, and patients were looking at me, I was looking at them, and I didn't really know what to say, but I used to say, it only looks like I'm not paying attention to you because I'm not paying attention to you. But it was very frustrating. Henry, big industry. Other sectors and industries have encountered technological disruptions or reimaginations while keeping the customer at the center of the operation. What lessons can healthcare learn from these industries so that we can maintain a human-centered patient experience and standard of care, even as we evolve to more technological and I hope complementary opportunities?
So I may act as a politician and change the answer, change the question. So David, thank you for having us here today, and of course, Dr. Tracy, thank you very much for pulling this together. So I was mortified when I saw who was on the panel because I thought Jason was 100% committed to pure telemedicine. And when you spoke, I said, thank God, and we're not going to be at odds. And then, Calvin, I was worried that you would have portfolio companies that were 100% committed to telemedicine. I said, oh my God, I'm going to debate this guy. So the good news is I think we're about on the same page. There are a couple of points I would make, and they tie a little bit into your direct question, and they relate to the concept that, and it actually goes to the issue of work from home as well. We can transact business digitally, absolutely no question about it. We can do a lot, but the one thing we can't develop and create digitally is trust. And you need trust in that practitioner. So I think a lot of the chores, preparatory work for a procedure, for example, can be done through telemedicine. But then, when you have to make that final decision on a complicated procedure, or if you just want to make sure that you're taking care of your day-to-day health issues, you want to sit opposite a real person. So it's a hybrid situation that is going to ensure that humanity continues in medicine. And I'll give you a very, very short story. Actually, I have a few, but the one I want to focus on, maybe there'll be time in a few seconds, for some others. I had to have back surgery, and I was talking to Dr. Tracy, and we were joking a little bit. He said, I wouldn't have had it, but I don't think he meant that. So I had lots of issues. I ski a lot, ski accidents and all of that. And, you know, if you've had back surgery, until you've had back surgery, you don't do any due diligence. But before you're going to have it, you ask friends. And everybody has a horror story on back surgery, a cousin, an uncle, all sorts of stuff. So we picked, my wife's a critical care doctor, and she picked a colleague. And the good news is that colleague works out of Mather Hospital, which is owned by Northwell today. And I was very nervous. I was going into the surgery, just about ready to go for the anesthesia, and the nurse held my hand. And the doctor saw I was nervous and came to speak to me. That took my blood pressure down. Of course, you're not going to operate on using telemedicine, but that human connection is so, so important. Of course, telemedicine and AI and all these vehicles are going to drive efficiency, but there's nothing to substitute for that touch.
So can we think about this in a, I'm going to call it a complementary way, which is no arguments here about the human touch and that connection at that time. But perhaps some of this technology will enable us to have actually more other connections that can be thought of as complementary. And I've always talked about this as, you know, we all hear patients say they want access, and because they think that just means an appointment to see their practitioner. But what if they could have a connection complementary to that access and always know that if they needed to speak to somebody or that they didn't have to wait for an appointment? Jason?
Yeah, so I believe very strongly that you can create the connection without necessarily being in the room with the person, whether that's a coach. And we always start our board meetings with patient stories, which are generally video testimonials of our patients. And we have stories where we finally put the patient and a coach in the room together for the first time. They've been working together for years, and there are tears of joy as a thank you because they've created such a connection remotely without ever being in the same room together. The other thing that I think is enabled by technology is the best matching of the clinician and the consumer. And we have a direct-to-consumer mental health business where It's virtual therapy. The two parties are never in the same room together. And we use machine learning and some artificial intelligence to create the best match between the consumer and the therapist. And all the data shows that that is the most important ingredient in successful therapy, right? Is that connection, and do you have the right match of the consumer with a therapist who can relate to them and who they trust for all kinds of different reasons, their expertise, but also their background, their sexual preference, their race, their gender, their ethnicity, and the ability to use technology on large populations at the same time to create that match is better than any of us could do by asking friends, colleagues, physicians, can you make a referral for me to somebody who you think would be right for me?
Kevin, you talked earlier about this. How do we ensure or help facilitate that, to Henry's point, that patients don't think we're trying to replace them with technology, but that it's complementary and maybe it can build trust?
Yeah, I think that, I'll move back out of the healthcare space and back into it. I think there are a lot of analogs that we can learn from. If you look at, what's happened in financial technologies, and some of the things those help to alleviate, but some of those things that needed to be addressed. What's access and convenience, your ability to be able to understand and appreciate what's going on in your banking and other financial activities in the time that is most convenient for you. I think that's an element of things. If you look at some of the things that have happened in terms of e-commerce and the way that AI is being used. So I think that goes back to partly what I'm hearing from both Jason and Stanley, and that goes to, do we actually understand you well, and how well are we meeting your needs? Any relationship that we have, if we moved it outside of the clinic into our personal relationships, there's that connection, and there's a common understanding. There's a degree of compassion. And there are elements of, things about me that reinforce who I am as an individual. So getting to real personalization. And I think that's where there's a tremendous amount of value. Far too often, those things are missing. You may have somebody in front of you, but you don't understand all the other people who have touched them. I think we've gotten a little bit better about that. You don't understand their family dynamics or their community dynamics, so you're not able to incorporate that in. You don't have a full appreciation of their preferences, and you're hurried, and you're rushed, and you've got to get to the next person. And I think that being able to pull that kind of data in, and actually being able to convey that, like so many other sectors, we've been able to work to a point where we get you and we connect with you, and you are not just the next number, is where this will actually be incredibly helpful, but we actually have to combine those things with it as well.
Yeah, Stanley mentioned something earlier which was so important. You're used to that human touch, you're used to that piece, but different generations perhaps won't know that as important. And while you and I may be waiting for the doctor to put a stethoscope on our chest, pretty soon it's going to be an ultrasound probe, and we're not going to know what's going on.
So that's 100% correct. So we have a remote patient monitoring system that we sell. Most remote monitoring systems deal with a particular device for a particular ailment. We have a multi-device remote patient monitoring system. I think it's great. It's a good idea. The doctor can have in front, if they're going to do a video call, they'll have all the information, the vital signs, and it can be monitored regularly. I think that's great. But I think we need to be careful also. And my concern right now, as many, relates to, it's not so much a legal issue, the ethics of AI. So we do sell today an AI system that is based on the history of millions of dental images, and it guides the dentist. But there is a small chance that the data we have, think about it, where are most dentists? they're in relatively middle class, slightly below middle class to more affluent communities. Is our database going to be the right thing for a community that is not affluent? And yeah, we're fine-tuning. And I think we'll do a good job at that. But my fear is, if you go into mental health, for example, and you got somebody, you stereotype them based perhaps on the wrong data. So I think we're heading in the right direction. I think this is going to be a great tool, AI, and it is already, but we have to make sure that we've adjusted, a little bit, Kelly touched on that, to the needs of the individual and the needs of that individual relative to the community where they live and their habits, health habits, etc., so that when we measure somebody against AI, we're measuring against, in quotes, the right average.
Yeah, we spent a lot of time earlier in the day, really worrying about the data in the big data sets in this. What about, you guys talking about practicing? How about, I know a lot of practitioners are worried about, oh my gosh, there's going to be mountains and mountains of data that's going to come from these wearables. How am I, as the practitioner, going to deal with it?
There's already a lot of data that exists. We know that. We're overwhelmed by data. We're not as well informed by that data as we should be. So, it's that taking that data to insights at the point of decision making. And I think that we'll be helped by that. And certainly, as we look, and we're committed to doing everything that we can to improve overall health outcomes, I think that will actually enable and equip that in ways that we have not seen before. So.
And I think insights is critical, and the opportunity is for it to be essentially a personalized interaction for the consumer. Some are only going to want to interact with something digital and get those insights themselves. Others are going to want to interact with a clinician where those insights are in the background, right? I think that's the difference between purpose-built healthcare solutions and trying to use an off-the-shelf AI tool to gain some insights and have it be a widget that's sitting between the patient and the clinician. And our opportunity is to make it really intuitive and easy to use such that it's just a natural part of how the physician interacts and goes through their decision-making and interaction with the consumer. I mean, physicians have always gone to resources, right? Whether it's the PDR or an AI insights engine, there's a resource there that can help the clinician with decision-making.
And my dream on some of this is that the AI will sort of do what it did for me in high school when I was fortunate enough to get a Texas Instrument calculator and replace the slide ruler that I couldn't use. And I'm hoping it's going to replace the mouse so that I can finally interact in sort of a real time, in a real casual way, still capture the data, still have machines to do the crunching of the data, hope the data is the right data so that the human experience can be amplified instead of destroyed.
But there definitely is a slight generational issue here.
Slight?
The younger generation will not go to a physician that doesn't understand how to use a computer. And when I say use a computer, I'm making it generic. We have a son who had to have brain surgery. Now, it was very serious. He turned out fine. And he had a choice. The world I come out of, we did our research, and there was a choice between a couple of very serious neurosurgeons, skull-based people. The most experienced of all, he went to see, and I'm not going to, it wasn't at your institution, don't worry. And the guy couldn't make the computer work. He called his secretary in to help him because there was some digital thing he wanted to see. And he could have been the best neurosurgeon in the world. My son wasn't going to go in there. I, on the other hand, may have said, you know what? That guy's been around many years. He knows what he's doing. So at the end of the day, whatever we're talking about, we may not be there. Younger people are going to just expect it, and we just have to get the tools there quickly. Otherwise, and they're going to want a hybrid between telemedicine and remote devices and all that kind of stuff. It's a fact. People in their 30s are not going to accept a practitioner that doesn't understand technology.
Well, and I think the main thing that they're not going to accept is they will not accept that they can't be connected.
Yes, precisely.
Well, listen, thank you guys. It's been a terrific time to think about just how much this actually means to what is really important, and that's our patients. So thank you very much.
Thank you.
Thank you.